Morning, one and all. Today we are going to deal with the last class of finance in dental care. In the next class, we are going to deal with the importance of the finance in dental care up to know which are the classes has been done. I will reveal what other questions might be asked from past years so that you will be aware enough of writing the exam how much importance the finance in dental care is. What are public programs in finance? In public programs, we are going to deal with the American methodology of the public programs that is dealing with the finance of the dental care or the medical care. Coming to the public programs, of which private practice is usually not able to meet the dental demands of all people. Therefore, a number of public programs aimed in meeting the needs of the specific groups of recipients in the diverse society. The public programs are sponsored by the government and also include community health centers, in which they are Medicare, Medicaid, and National Health Insurance. These three programs most probably are done in America, USA. But in India also there are some of the services of the public program that is rendered by the Indian scenario. There might be regarding the CGHS, that is central government health schemes, and EHS, employment health schemes, and Arogyasri, and some of the NHM, National Health Mission programs that have been conducted in this manner. What is Medicare? In the title of the Social Security Amendments of 1965 of the 18th program is named as Medicare. This program removed all the financial barriers for hospitals and physician services for all people aged 65 and over. So this program is meant for only the people which are 65 and more, regardless of the financial means. By the 1970s, Medicare has two parts, that is Part A and Part B. The Part A, they are hospital insurance, and Part B is supplemental medical insurance. Both parts contain highly complex services of benefits that are made be available in both parts that require some payment by the patients. Medicare was brought into being because of the voluntary health insurance system was unable to provide adequately for persons over the age of 65. The medical assistance of the age, that is MAA program of 1966 attempted to low income of few persons aged 65 and older, but was too cautious to be successful. The rental segment of the Medicare is limited to those services requiring hospitalization for treatment, usually surgical treatment, that is the treatment of fractures and cancer, and hence constitutes a negligible proportion of the program. So it is limited to only the surgical treatments, especially regarding the fractures, might be to the mandibular or maxillary fractures or any types of accidents that are leading to the fractures of the face, and also the cancer, regarding so many types of treatments regarding the cancers. Okay, these are negligible in proportion of the program. These are the parts of the Medicare, that is hospital insurance. As said, Part B is medical insurance, and they have been included with Medicare of Advantage plans, and Part D is with the drug plans that has been recently upgraded. What is Medicaid? This is also a USA program. It means that in the title of the 19th of the Social Security Amendments of 1965, the original intent of the program was to provide funds to meet the healthcare needs of all indigent and medically indigent persons. Medicaid is a joint federal-state program. In order to qualify, the federal governments share a Medicaid financing. Every state of Medicaid program must cover at least of these basic services. They are inpatient hospital care and outpatient hospital care, laboratory and X-ray services, skilled nursing facility services, home health services for individuals aged 21 years and older, early and periodic screening, diagnosis and treatment, that is EPDST, that is early and periodic screening, diagnosis and treatment program for individuals under 21 years, family planning services and physician services. Especially they have been included in all the groups, not in the middle-aged, especially regarding above 21 to 40 years. In which dental care is not a mandatory service except for persons under 21. That is part of EPSTT, that is regarding the Medicaid Act. The American Dental Association supported the EPDST, that is Early Prevention and Diagnosis and Treatment Program, were enacted into the law of 1968 because of the first time of the federal program mandated dental care for indigent children. The program therefore had a potential for bringing the dental care system so that millions of indigent children and youth are being fulfilled with the dental treatments according to this Medicaid. Medicaid is an extremely complex program as it is complicated and confusing to many people. Although the program has reached a large number of people, inevitably there are loopholes also. Certain groups such as widows under 65 and families without children have been identified and is not being eligible for the benefits of the Medicare. This is the drawback of the Medicare program, where the widows of under the 65 years or the families without children have been neglected in the Medicare in the dental care especially. Therefore, many persons are still unable to receive the dental care as required. People who can get the Medicare is a picture that is been showing here, the Medicare program that is being implemented. Coming to the third public program, that is National Health Insurance. The National Health Insurance was introduced in Germany at Bismarck in 1880s and in Britain by Lloyd George in 1910. While humanitarianism was a factor in their development, a more powerful stimulus was probably the awareness that a healthy and secure society led to a political stability and greater economical and industrial strength. The National Health Insurance is primarily a financing mechanism by which healthcare services are paid for from the publicly organized fund. Opponents of the National Health Insurance said that the program would be inflationary for care. Supporters of the National Health Insurance say that while the global cost of healthcare services would be likely to increase, the load would be more equitably distributed and the end result would likely to be healthier, more secure and more productive society. Financing dental health services in India. They are: number 1. Fee for service. A majority of the dentists in India provide dental services on a fee for service basis. Other facilities providing fee for service are private hospitals and private doctors, facilities of private firms or enterprises, medical education or research and training in the private sector. And the second one is dental insurance. Insurance companies have now started offering dental insurances in India, which covers not only those dental treatments which require hospitalization, but also covers dental checkup, oral prophylaxis, restorations, and even dental extractions. This is with the programs that is regarding the private insurance companies like ICICI Lombard, Bajaj Finance Insurances. So many insurance companies nowadays are offering the dental services in the health insurance also. Free or discounted rates. In the hospitals of the state government, like the dispensaries of the state government health services, and also rural and urban health family welfare centers of state government, facilities of various central ministries such as defense and railways, facilities of the employment state insurance scheme in 1948, and facilities of the central government health scheme in 1954, facilities of the autonomous institutes and societies are offering free or discounted rates of services in dental care also. So by this we conclude the finance chapter, that is private fee for service will likely to remain as a predominant method of financing the dental care in foreseeable future. Developing countries like India are in transition period during which alternative feasible modes of financing and delivery services will evolve. Dental personnel and healthcare services organization can be certain that financing the dental care is an important dynamic area, and there could be a further expansion and evolution with new concepts that might emerge. So I conclude with this entire chapter of finance in dental care. In the next class, we will be dealing with the previous questions which are important in the finance in dental care. Thank you.